This is patient case O. Hi, Mrs. O. My name is Amelia, and I'm a student physical therapist under the direction of Dr. Sykes. I'm just going to be running your evaluation today. So after your motor vehicle accident, there's a few structures I want to look at. One being in your neck and your low back. So I'm going to be looking for your motion ability and the strength of those muscles in those areas. So I'm going to be filling around, finding different landmarks and filling around those muscles in those areas. Is that going to be okay?
Yeah.
Perfect. The best way for me to access those areas and see what I'm doing would be easier if your shirt was off. Would you feel comfortable removing your shirt for this evaluation?
Sure.
Perfect. Okay, so the first thing I want to do is measure your motion in your neck, just your lateral flexion or your side bending. I'm going to be using these tools. They just tell me the degrees of how far your head moves.
Okay.
So let's just have you start with the right side. Just want you to bring your right ear to your right shoulder. Good. Is there any pain with that?
It's, it feels like a stretch, maybe a little bit of an ache, but nothing terrible.
Okay. Just let me know if the pain gets too intense or anything.
Okay.
Let's have you face this way. And we'll have you bring your left ear to your left shoulder. Now I'm just going to put my hand on your shoulder and on top of your head and apply a little bit of pressure, okay?
Okay.
Okay, good. Go ahead and come back up to neutral. Does that feel okay?
Yeah.
I know it's a little
aches,
achy.
but yeah.
Okay, so the landmarks I'm using for these, so I'm going to put one on top of your head and one at the base of your neck. So I'm just going to feel for a certain vertebrae or a bone in your neck, okay?
Okay.
So I'm looking for C7 vertebrae, which I think is right here. Go ahead and slightly flex and come back up. Good, so I'm on it. I'm just going to zero these out. Okay, go ahead and bring your left ear to your left shoulder. Okay, good. I have it at 55 and this one at 5, so 50 degrees because they moved in the same direction, which is good because normal range of motion of lateral cervical flexion is 45 degrees, so you have good range of motion.
Cool.
The next thing I want to do is measure extension of your low back, so we're just going to be leaning back and I'm going to use this tape measure. So let's just have you do the motion first, and then I'm going to apply a little bit of pressure to get a little bit more stretch in that position. Okay, so we're just going to have you put your hands on your hips. Let's have you face this wall, and if you could step over here. Okay, perfect. And we'll just have you go back. And I'm just going to put my hands on your legs, or on your small back, and on your chest, okay?
Okay.
Apply a little bit of pressure. Okay, good. Go ahead, come back up. Okay, so the landmarks I'm using is I'm just going to put this at the top of your pelvis or the very low of your back, and they're going to measure up 15 centimeters and take a measurement when you go into that motion, okay?
Okay.
So I'm going to start with feeling your hip bones and kind of work my way till I get that area. Is that okay?
Yeah.
Okay, so I have it's PSIS and then S2 sits in the middle. I'm going to measure up 15 centimeters. Okay, go ahead and go back into extension again. So I have them measured at 12 centimeters, so that's a 3 centimeter difference. Go ahead and stand up. We don't have a norm for the tape measure approach. It's just to get a baseline, so when moving forward we can measure again. But normal range of motion of lumbar extension is 20 degrees. So that's all the motion I want to do. Let's have you lay on the table, or actually let's have you sit on the table. Okay. We're going to measure some strength in your muscles. Go ahead and face that wall. So I want to be testing the muscles in your neck that do lateral flexion of the head. The main muscle that does that is sternocleidomastoid. It's a big muscle that goes from your sternum and your clavicle up to behind your ear on the mastoid process.
Okay.
So let's just have you do your right side first, just to give me a good baseline of what you're at. I'm going to put my hand on your shoulder and I want you to keep that position, and I'm going to apply pressure up, okay?
Okay.
So hold it right there. Hold, 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 and relax. Good. Let's do your left side. shoulder right there. Pull, 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 and relax. Okay, good. I give both of those motions a 5 out of 5 because I feel like I couldn't have pushed any further or harder. I felt the patient had maximum ability to hold that position. A good gravity minimal position for this test would have the patient lay on their back, and I would hold their head up off the table and just guide them or follow them as they do lateral flexion. And I'd be having my fingers on that sternocleidomastoid feeling for contraction. Okay, so the next one I want you to do is lay on your stomach, testing that low back muscle. The muscle we're testing there is the multifidus, which attaches on the sacrum and the lower vertebrae, and then it will attach on the spine processes about 4 above of where it originated. So what I'm going to have you do, Mrs. O, is put your hands on the back of your head. So I don't want you to use your arms to push yourself up. And then I'm going to be bracing your legs on the table so they don't move. I just want you to, the best of your ability, bring your trunk up off the table. So go ahead and bring your hands behind your head. And whenever you're ready, go ahead and bring your trunk off the table. And good, come back down. So I'd grade that a 5 out of 5, just because the patient came up with quite ease, and it looked like they came up to about normal range of motion from what I could see. There's only a grade 4 or 5 in this position, so there's no gravity minimal position. How did that feel, Mrs. O?
Good.
That's all I have for you today.